My own name is Bláthín Casey. I'm a physio by background, but now working with the Healthy Eating Active Living programme in health and wellbeing, which sits in the same division as the tobacco programme. And I'm working on designing a physical activity pathway for HSE. So why design a physical activity pathway for HSE, and what I mean by that, what is the physical activity pathway? We know through MEC, opportunistically, we should be asking people about their health behaviours, smoking being one, of course, and with smoking, when you want to assign and assist someone to quit, the quit.ie and quit services is there. In terms of physical activity as a behaviour, when physical activity is raised, the healthcare professional at the minute, because we don't have a physical activity pathway, there's no direct pathway as such beyond advising the person that being more active is beneficial and you should be engaging in exercise. So the aim of our work is to design a pathway that through that process will assist our healthcare professionals to be able to refer or signpost people to a physical activity opportunity. And why? We know the benefits of being physically active. I think I'm speaking to the converted here as all being in health. We published national physical activity guidelines and sedentary behaviour guidelines at the start of the year. If you're not familiar with those, just give them a shout out. That's the Every Move Counts, so our national physical activity and sedentary behaviour guidelines for Ireland. So we have guidelines. We know people should be aiming to meet those guidelines, but through national surveillance data like the Irish Sports Monitor, which is the middle figure there, we know that only about 38% of the population are meeting those guidelines. Still a need to do something. And the World Health Organization, that's that first image there, this document by the World Health Organization, More Active People for a Healthier World, has recognised 8 areas or 8 best investments for promoting physical activity. And one of those 8 best investments is health. So health having a role in promoting population level physical activity. We've known this for a long time, and there's a history and a background within the HSE as to why I guess this hasn't been done before. But there has been work happening in this space going back as far as 2016 when HSE published the National Exercise Referral Framework, and would have referenced that we needed something like a national physical activity pathway or an exercise referral piece. But in 2017, an assessment of readiness was done by HSE, and it was concluded that we would halt work around making every contact count, and the self-management support framework was happening at the time. So it was decided to pause, let making every contact count and this self-support management framework start, and then we would come in. So that's where we are now. As you're aware, we have making every contact count and the National Framework for Integrated Prevention and Management of Chronic Disease. And really excitingly as well, and I know it's happening in, Martina might have given an update on that this morning, I'm not sure, apologies, I wasn't here, but the HSE app is also in development, and we've recently given the green light to integrate our physical activity pathway into the HSE app space. So we've been working with the app over the last number of weeks and to get integrated into that space. I've referenced this already in terms of what is a physical activity pathway in healthcare. I will use these terms interchangeably. A physical activity pathway in healthcare, which is that set of steps that a healthcare professional can take to encourage a person to be more physically active. But I'll also use the term a physical activity pathway and healthcare model, and that really describes the organisational enablers that can support and build capacity for a healthcare professional to implement the pathway in their clinical practice. So on a basic level, similar to MEC, the pathway is the circular image shown there, and where you're opportunistically screening someone and raising the topic of discussing physical activity with the person in front of you. You intervene by giving brief advice, and then it's active participation primarily outside of the health service to a physical activity opportunity and review and following up. So that MEC piece. It's important when we speak about the pathway, understanding who the pathway is for, and we have designed a tiered approach to the physical activity pathway in healthcare with 4 tiers. So tier 1, recognising, so I'll start at the bottom and work our way up. So Tier 1 is specialist physical activity services. So this is for people living with chronic disease and that require rehabilitation. So we know that for about 10% of the population and people living with chronic disease, that they will require a time of intensive exercise or rehabilitation that is clinically supervised. So that's your things like your cardiac rehab, your pulmonary rehab. But for about 90% of the population, even if they live with the chronic disease or not, we do know that they should be safe and well able to exercise outside of that Tier 1 medical supervised exercise space. That brings us into Tier 2, which is referral to exercise physical activity program. Tier 3, signposting physical activity support, with the idea to move people out of health, which happens around Tier 2, into Tier 3, happening in that community outside of health space, to Tier 4, people being independently active in their community. So probably what you're wondering now is, what does all that look like, and what exactly is that? And this is what we want to achieve in terms of the pathway, with the app and hsc.ie, that digital space being the platform and where the pathway will sit. And again, where does the role of the Stop Smoking advisor come into this as well? And you can see that's referenced here in that first bubble diagram, where brief intervention might occur. So albeit you might have a person that's looking to quit in front of you, and the main reason why you're having that conversation with them is around their smoking behaviour and wanting to quit. But of course, we know through MEC that opportunistically, if there's a space where the person wants to discuss another health behaviour, that can happen. Or if through the person speaking about their smoking journey and their quit journey, physical activity is mentioned, there is that space we would recognise for you then to discuss physical activity as a behaviour with them. And through this pathway, you now will have that supported pathway to be able to have that conversation and assist them in doing something or being signposted or referred somewhere. So the pathway happens, that brief intervention happens. The person then is referred, signposted into the pathway, which is on hsc.ie or the app. They're then offered a digital offering, so they come into the app space. There'll be a public landing page where they don't have to sign up to an exercise 12-week program per se. Some people might just want to come into this app space and just want to know about the benefits of being physically active, living with chronic disease, or remind me about what the guidelines are, what I should be reaching to do. Other people might come into the app and we have a bank of exercise videos for you to follow on your own time at home, a suite of yoga videos, strength and conditioning programs, walking programs, etc., pre-recorded material. Or they might want to come onto the app, and something that I guess our healthcare professionals, because they don't have the remit to do that, be aware of all of the physical activity support that might be happening in the community. It's really hard to keep up with that, even as someone in the physical activity space. So there'd be a space on the app where maybe someone wants to find out what's happening in my area. And working collaboratively with Sport Ireland, there's now a national data repository called getirelandactive.ie, so you can look that up and you'll be able to find out what's happening in your area. But we're also going to have an offering on the app where people, if they want to sign up to a more intensive program, a more intensive behaviour change program as well, will be offered on the app as well. So that's the offering. People come into the app, they'll engage with it as and how they want it in terms of what offering they would like to get from the app, with the idea through that last box that it builds capacity to support independent participation in community physical activity. And of course, all the while remembering those 3 light blue bubbles at the bottom, that we do recognise that there will be a percentage of the population that this app and this physical activity pathway through the app offering won't be relevant for or suitable for. And again, that's that 10% of the population who are probably needing that more medical supervised offering. But there's no reason why, once they're discharged from those programs, they can't then be signposted and referred into the pathway. So this is my second last slide, so nearly there, the most important slide for the people in the room here. So what could the role of the smoking cessation officer, the Stop Smoking advisor, be in this physical activity pathway? this box that's pulled out here, so we are developing a physical activity pathway and healthcare model document that sets out a number of recommendations and actions to ensure we effectively implement this pathway. And there's an action, as you can see here, action number 6, assigned to health promotion and improvement and the tobacco programme. And that action is to agree processes, including training and monitoring, to support smoking cessation officers to integrate the promotion of physical activity into the delivery of standardised smoking cessation programmes. So discussing this with Martina in terms of our current thinking around that and how we could support the SSAs. I don't know if that's an acronym that you use, maybe it is, or I've just used it there, to train the SSAs through Quid Manager, through your webinar outputs, your Friday Quid bits, make reference to physical activity and the physical activity pathway through the NCSCT training, and include inputs at the professional development training days. And again, I know you have a messaging framework and flow through Quid, and again to include a messaging template within that offering as well in terms of the messaging framework. But ultimately, I guess it's again coming back to that thinking around you have the opportunity that you're working with the person in front of you around a behaviour, be it smoking, and if the opportunity comes up to discuss another behaviour because they want to do that, they've referenced physical activity and exercise as something they're doing and need help with, that we now have an offering coming down the track in terms of the physical activity pathway, and we'll be putting this training and offering in place to support you to do that. And that is me. If you want to reach out to me, then say that's our contact details. But thank you very much, and again, thank you to Elaine and Martina for the invite.